Hello, everyone. Good afternoon to all of you. I'm Sayukta from the Resonance Show YouTube channel, and I hope all of you are doing well and staying healthy. Today, we are going to talk about a very common yet often ignored problem, allergies, and how they disturb our sleep and breathing. Many people complain of blocked nose at night, constant sneezing, mouth breathing, snoring, waking up tired even after a full night's sleep. Some even say रात को सांस लेने में दिक्कत होती है या नींद पूरी नहीं होती है. ये भी एक बहुत कॉमन कंप्लेंट है. What many don't realize is that allergies can be a major hidden reason behind poor sleep quality and breathing issues, especially at night. If left untreated, these problems can affect your energy levels, concentration, immunity, and overall quality of life. So, today's session is all about understanding A, how allergies impact our breathing, why they worsen at night, and what we can do to sleep better and breathe freely. To help us understand this important topic, we have a very experienced expert with us today. Please welcome Dr. Seemab Shaikh, a renowned specialist, joining us live today. Dr. Shaikh is an ENT surgeon. He is currently practicing at SAS Sleep Disorder Clinic. He has vast experience in diagnosing and treating allergy related conditions, breathing problems, and sleep disturbances. His practical approach and patient friendly explanations have helped many people manage allergies effectively and improve their quality of life. A very warm welcome to you, Dr. Shaikh.
Thank you, Sayukta. Thank you very much for having me on board.
Thank you for sparing time for this very important discussion, Doctor. So let's start our today's discussion where the topic is how allergies affect our sleep and breathing. So, Doctor, first of all, we would like to know what is an allergy. We often, as a layman, we often get confused. Is it an infection? Is it some kind of allergy? What are these allergies?
So, Sayukta, allergy in itself is nothing but, it's an inflammation of the lining of the nasal cavity. Okay, we are talking, I'm going to restrict myself strictly to nasal allergies as an ENT surgeon. So, whenever you have these allergens that hit onto this inflamed mucosa rather, there is going to be a body response, and that body response is done by the release of some substances in the body, histamines, and everything that you get as a symptom of allergy or allergic rhinitis is related to these factors. Now the allergens, like you asked, are plenty. I mean, you could be allergic to about anything in life. It could be your bed sheet, your new fabric, your new curtain. Mostly people only know lots about things like dust mite allergy, house dust allergy, or they know about food allergens. They know a bit about pollen, but allergy could be due to anything possible. Some new deodorant or some new kind of cosmetic that you picked up, some new fabric clothing that you picked up. It could be anything. And whenever there's an allergen exposure, then this entire cascade of events start happening, and the patient gets allergic to the gets totally symptomatic to these allergens, right?
Right.
Allergens, like you asked me, are of different types. They could be food, they could be inhalational, they could be drug allergies. There's plenty of things that you could be allergic to.
Right. So the list is really long. So anything
Exactly.
under the sun and even the sun can cause allergy. So yeah, a number of things could act as an allergen. Now, doctor, is it that they are increased during cold weather?
So you will always find seasonal variations of allergy.
Okay.
Weather changes, temperature changes, change in the environment, all this can definitely precipitate allergies in patient to patient. So that's why we have allergies which are seasonal. There are allergies which are round the year, around the clock, round the year. So we had these terms earlier which were like seasonal allergic rhinitis or perennial allergic rhinitis, which now the scientific world has changed, and we have kind of modified them to be in terms of persistent and intermittent, and with their severity, whether it's mild, moderate, or severe. So we kind of classified it that way. But yes, to answer that question of yours, it is seasonal. It could be seasonal. It is not necessarily cold weather. It could also be rains. It could be sudden change of temperatures from hot to cold also could trigger your allergies. It could be the pollen season, the harvest season. Anything could trigger your allergy as it comes.
Right. Doctor, many a times we see that, whenever we sleep in AC, in air conditioner, and we wake up with maybe a blocked nose or we start sneezing. So, can sleeping in AC increase the symptoms?
So it would be wrong to just blame the AC per se, but it's also about the temperature that you sleep in. Because if you
Okay.
sleep in a very low temperature, like most of the people are used to having their ACs at 17, 18, and they want to get under the blanket and then sleep, which is where the body temperature control starts shifting. So whenever the body has to maintain that temperature control, then obviously there will be nasal related engorgement because blood has to flow to get the warmth here and there. So it's generally not just about AC per se, but the temperatures that you keep it at. And the main important thing generally is the ducting of the ACs and the filters. Now that's something which is very overlooked by a lot of people. Whether you are in a centralized air conditioning system like in some of the hotels that you are in or in the buildings and apartments, these ducts don't get cleaned very often. I mean, I'm sure everybody understands that the maintenance of these ducts and the maintenance and cleanliness of the filters doesn't happen as often as we would want them to be. And that's where probably fungal infections or fungal spores, or even for that matter, even things like the dust particles settled in those filters, they will be coming out, and that is what aggravates the entire allergic scenario.
Right.
So
I
if
think
at
this
all
is
you
a very
want to
important.
sleep in the AC, just make sure that your filters and your ductings are regularly well maintained.
Right. So I think this is a very important takeaway. Just don't blame your AC alone. Keep a check, keep monitoring the duct and the filters. They do need regular cleanups. It is equally important. Now, doctor, talking about how allergies affect us. So, how they affect our breathing and our sleep.
So when we talk about nasal allergy, Sayanta, everything is related to the nasal breathing then, right? Because when you have an engorgement of the nasal skin lining or the surface of the nasal mucosa getting engorged, it is going to cause nasal obstruction. This is going to cause difficulty in breathing. This is not only during the day, it sometimes worsens at night because when you lie down, then there's a lot of blood collection in those tissues that are there in the nose. And as a result of this, when you have a difficulty in breathing, or if you have, let's say, a lot of mucus in your nose, that mucus is obviously going to filter down and fall down by gravity into the throat, thereby giving you that throat irritation or the cough and things like that. So, all these things cause a difficulty in breathing through the nose. Now, if you're not able to breathe well through the nose at night, obviously you're going to wake up intermittently. You're going to repeatedly wake up, or maybe the allergic symptoms get worse. Then, in that case, you will wake up with the sneezing, running nose, and complete nasal blockages. All these are going to disturb your sleep patterns. So, it is just not the nasal allergy per se, but the difficulty in breathing through the nose that breaks your sleep patterns. Maybe you wake up 10 times for sneezing, and as a result, your sleep gets completely fragmented. So, what do we mean when we say fragmented sleep? So, for us to have good sound sleep and to be very refreshed in the morning, one has to have a cycle of 90 minutes, which is called a complete cycle of sleep. It's a 90-minute cycle in which you go down from stage 1 to 2, 3, 4, and then come up 4, 3, 2, 1. That's one complete cycle of 90 minutes. Now, if along the way you've been waking up 10 times at night with either a sneezing or wanting to blow your nose, or for whatever reason that you have to because of nasal difficulty in breathing, then this cycle of yours gets broken. And when this cycle gets broken, your sleep is fragmented. And although you may have slept for 10, 12 hours at a stretch, but it's all fragmented sleep, and it has not given you the refreshing feeling that it supposed to be when you've had an 8 or 10 hours sleep. So nasal allergies have a very, very, very strong impact on your sleep quality. Very strong impact, and that's why we, as as a sleep specialist and an allergy specialist, both of which I practice and are my fortes, we are very, very what we say, we impress very highly onto the patient that you need to control your allergies before we get into any sleep disorder investigations or treatment, because this is like the first line of problem that you could be facing.
Right. So many a times we don't realize we get this, fragmented sleep, and that makes us quite fatigued, etc. And when we go check with the doctor, maybe then that's when we come to a conclusion that, something keeps on bothering us during night. It may be a blocked nose, whatever. But then we have to be very careful about it. If you also have, sleep disorders, etc., please go and consult a qualified ENT specialist. They'll help you in jotting down the problem. Now, doctor, another very common thing that we often see is throughout the day, I may be absolutely fine. No problem, no sneezing, no coughing, no blocked nose, no problem in breathing. But the moment I get up after a sleep, I see that one side of my nose is completely blocked, or I see a lot of white discharge around my say mouth or nose area, or and of course the sleep was not that good. So what is that? Throughout the day I feel comfortable, but whenever I go to sleep, I get up with these problems.
Yeah, so Sankar, like I just explained just now, that when you have a nasal engorgement, when the nose gets blocked, there is mucus that is forming either in front or behind the blockages. So the ones that get formed behind the block cannot come out through the nose in the front. So it is by default and by gravity going and falling behind, or it is stagnating over there through the night. So as a result, when this is stagnated through the night, when you wake up in the morning, all this is then going to be coming out. The mucus that is there in the front of the blockage that you may have is probably the one that can come out forward from the nose and not from behind. And that's what you generally tend to see in and around the nose when you wake up, because you've been quite stagnant through the night in one position. So when you are stagnant in that position, when you wake up in the morning, obviously all this will be seen in and around you. And the same thing happens if you have some, kind of a oral block. Let's say you have a tongue or something which is falling inside or doing any kind of an issue, creating any kind of a blockage. Then the saliva that is formed in your oral cavity through the night also has no way of, going behind. And as a result, you get a lot of drooling of saliva from either sides of the angle of your mouth.
Right. And many times people also complain of getting up, panicking during night because they feel that they can't breathe. Mostly when they are in hotels or places which is not properly ventilated, and especially during winters, when we know there is no AC, no fan, etc., that is going on, windows are closed, they will suddenly get up at night and complain that oh, I'm not being able to breathe properly. Morning again, they'll be as normal as they were day before.
So here, Sayunta, no, we'll have to understand two different concepts. One is the concept of claustrophobia, where sometimes people feel very claustrophobic and anxious in a closed environment. Okay, so because of that anxiety, they probably do wake up. That is one part of it. The other part is when there is an actual problem with the breathing, right? Now, see, God has given us a body which is very well, it's a very well architectured kind of a situation where everything works in tandem. So, let's say you are sleeping at night and your nose gets blocked because of allergic rhinitis, or like what I deal in issues like sleep apnea, where the tongue is falling behind or the palate is falling behind and the patient is not able to breathe. Now, whether it is the nasal problem that's causing the blockage of the air, or there are problems below, what happens is there is a fall in oxygen supply, right? Because you're not able to breathe, your body starts losing its oxygen supply. Now the body is built to be able to tolerate lack of oxygen for a certain amount of time and to a certain level of the drop. Anything that drops much more drastically or for a longer period of time is obviously going to be very detrimental to the body. Right? So, what normally happens, God has given us a protective mechanism. So, the minute your oxygen starts falling down, there are signals that go to the brain, because every time in the night when you're breathing, your body has to be oxygenated. So, your brain needs the required oxygen, your heart needs the required oxygen, the rest of your body, your muscles, everything requires the oxygen through the night. Now, brain, being the most sensitive part of our body, is the first one to start feeling the effects of the falling oxygen supply. Now, when that oxygen supply starts falling, and if it falls or starts falling to a dangerously low level, and let's say it lasts for a longer duration of time, more than say 20, 30, 40 seconds, sometimes it depends on patient to patient. Now, this is the time when the God given protective mechanism comes into play. So, the brain, being the master central unit of our body, identifies that there is no oxygen supply coming to me, and it gives out signals to the rest of our, what we call in the medical world as the motor signals, the ones that are supplying the muscles and the rest of our body and what it has to do. So the brain sends out motor signals to the rest of the body saying, listen, do something, I'm not getting the required oxygen supply, and you have to do something so that I get the required oxygen supply. That's when suddenly the body just goes into a little bit of spasm, or it moves, and the involuntary muscles are moved by the brain signals, voluntary muscles, sorry. And that's when a person wakes up. And then when you wake up, you start breathing on your own. And then again, this kind of cycle continues. So, this is the basic reason why a person wakes up choking in the middle of the night. Now, that choking could also be compounded because of the nasal allergies. So, if your nose is blocked, that's where the first level of entry of oxygen or air into the body comes from. So there are times when the nose is blocked, so the patient will have to open his mouth and breathe through the mouth, and that would give you the required oxygen. But that's when you get the mouth breathing and the snoring and everything else. But for any reason, if that doesn't happen, or if the nose is also completely blocked, then these kind of situations can occur.
Right. Doctor, which type of allergies affect breathing?
Every kind of allergy can affect breathing. Like I mentioned to you, the allergens need to be identified. It
Uh,
could be, like I said, it could be inhalational allergens, it could be just simple dust, it could be the fine dust particles because of the construction that is happening all across the country in all the major metros. So it could be dust, it could be pollen, it could be newer, fragrances, it could be chemicals, it could be anything. It could be just the fabric, also the food that you eat. Everything contributes to allergy. Everything
doc-
can contribute to allergy.
right, right. Doctor, any particular time of the day when allergies get worse?
No, there's really no such particular time. The time is based on the kind of exposure that you have, where you are and what you have gotten yourself exposed to is what decides the time when you have the allergic reaction. It's not anything to do with your day to day rhythm. But yes, in the morning, sometimes definitely, because through the night you have just been lying down and all the mucus has been collected, all the allergens are there. So sometimes you will have a lot of people complaining of early morning allergies and early morning sneezings and early morning blowing of the nose and snorting it all out.
Hmm. Right. Doctor, so far we have understood that anything and everything can cause allergy, and any kind of allergen can, impact our breathing and thus the sleep. Now, what should we do? First, there could be like very, rare incidences of me waking up in the middle of the night or not being able to breathe properly or clogged nose, etc. Maybe twice, thrice in a year. That is okay. But when should I be alarmed and go and consult a doctor like you?
No, so anytime you have symptoms which are lasting beyond a certain period of time, it is obviously very prudent to come go ahead and consult a doctor, right? A specialist of allergies for that matter. See, you have to be very practical. It's not like just because you have a sneeze or a cold one day you're going to rush to a specialist or rush to a doctor. So
Hmm.
everybody does try their home remedies, everybody does whatever is needed to try and get better, right?
Hmm.
But let's say your symptoms are persisting in spite of you having tried whatever home remedies you would like to try. And suppose the symptoms are recurring. Let's say you had a problem in the first week of Jan, you got better. You had a problem again in the first week of Feb. Again, you got better with medicines or whatever you tried. And again, it's happening again after 20 days, 1 month, whatever. And these are signs when you really need to consult a specialist, because that means you're not dealing with the routine run of the mill cold. So I can see somewhere in the studio chat somebody's asked a very interesting question and said, "How do I know if it's allergies or a cold?" This is
Yes,
your
yes.
answer to that. This is your answer to that. That if you have something which is persisting and it is recurring, then it's definitely not a cold, because a cold, as a layman understands it, is a viral infection which probably comes and goes away within about at least a week's time or so. People get better. Although lately, as practicing specialists, we have realized that the viruses are also becoming very virulent. And there was a time 20 years back or 25 years back when I started practicing. I've been practicing for 3 decades, but maybe even 20, 25 years back, if we would have a viral cold, we would tell the patient, okay, don't worry, just a bit of symptomatic treatment and you'll be fine in 4, 5 days. It's a viral and you go away. Today's date, what we are seeing in our practice is the fact that viruses are quite virulent. It doesn't take 3, 3, 4 days. Sometimes it goes on up to 3 to 4 weeks for a viral infection to settle down. And then also post a viral infection, there are plenty of uh, symptoms and issues that still persist to a person.
Right. Doctor, as you were mentioning that, normally what happens whenever we see such symptoms, we try home remedies, and there are a lot of people again who have mentioned, can drinking warm herbal tea help reduce allergic symptoms? Can honey help soothe on itchy throat caused by allergies? I'll seek answer for these as well. But you know what happens? Many times we waste a lot of time in these home remedies or DIYs as told us by various influencers on social media platforms, or any friend or relative suggesting something that, okay, I also had the same problem. This is my prescription. Go get it and you'll be relieved. Or in a country like India, because over the counter medication is so easily available, and we all are self doctors, even if we have not done MBBS, then also we claim that we are doctors. We'll go ask for an anti allergen. uh, Everybody know various names and we'll start treating ourselves. What's your take on wasting time? I'm not saying that once or twice it may be okay, but doing it on a regular basis using home remedies, DIYs, or these medications all by ourselves.
See, Sayanta, it's a very important topic that you kind of touched on. So we as scientific people always believe in the science. Now, science is of different types. There are different pathies that are followed in our country, and you know, we have some of them are very evidence based, some are not. Mine is a very personal take on this, so I can't be held on this, whatever I'm saying, in the sense. What I feel is that everybody would try home remedies definitely, and one should for the first day or 2 days or whatever. But like I said, whenever you see signs of no improvement, or whenever you see signs of any kind of worsening, or things which are not routine, like, okay, there's a mild fever, you've taken some kind of a medication for it and it has died down, it has not come again, or you have a little bit of nasal blocks, you've taken some across the counter medication and taken steam and things like that, and you're better, then that's perfectly fine. I mean, this is a large country where people will be, very busy, and depending on how much importance they give to their symptoms, this is something that will always be tried, and I don't see any harm in people doing that. My
Right.
only take home message to all the people and all my patients and everywhere that I am asked to come in, give some inputs, is that please do whatever you wish to, whatever suits you based on whatever you've heard from your friends, relative, maybe even influencers. But be very careful when you're dealing with chemicals, or when you're dealing with drug related or rather medicinal related issues. Things like honey, ginger, turmeric, warm water, these are, for years, thousands of years in our culture
Right.
and in our ancient history. So these don't normally do much harm. But if you're going to take across the counter pharmacological medicines, please remember that every medicine always has some beneficial effects, but if misused or if not used in the right manner, right dosage, right combinations, it can have adverse effects too. So, medicational therapy, if you want to get into, please do it under supervision of a qualified medical personnel and not just on the basis of people or hearsay. I mean, this is my very strong
Right.
message which I give out to everybody. Nobody says that you should not do your, routine run-of-the-mill home remedies. Yes, of course, why not? And they do help. But in whom will it help and in whom will it not is a very subjective thing. Something might
Right.
help me, may not help my next person. Something may help me soothe in my throat, it may not help the next person. So it's a very subjective thing, it's a very personalized thing. But definitely be very careful with across the counter medication beyond a certain dosage and beyond a certain period of time.
Right. I think that's a very important take-home message. Now, doctor, when a patient comes to you with these symptoms, as you said, and you're continuously emphasizing on the fact that it's important to find out the trigger or the allergen so that we can, control that exposure to that particular allergen. That is one thing. So why, how you end up finding the allergen? B, what are the various treatment approaches that are available to deal with allergies?
So, it's not very difficult, Sayanta, today. Today, science has gone leaps and bounds. It's not what it used to be 3 decades back when I passed out. Even after we pass out, so much keeps happening, and it's a never-ending, knowledge, a sea of knowledge that's out there. So today we have wonderful tests for allergies, very wonderful tests, which can actually not only tell you how allergic you are, but can also tell you what are you actually allergic to, right? And then, because of the advancements in science, we have very good treatment for allergic rhinitis. Very good. So I'll come to that part again. But there are simple blood tests that are there for allergy. There are what we call as the skin prick tests, where we can identify every possible allergen that one can generally think of. And there's about over 150 allergens can get tested. And that's absolutely not a difficult task at all in today's day. The only thing that sometimes patients need to realize, because I do get a lot of patients who get themselves self-tested. Now, what they need to understand is they would not know exactly what all they would, probably need to get tested for. They would do things for the routine things that are known to a lot of people. But what they do wrong many a times is that they have already taken medicines for almost about a week, 10 days, and then that's not helping, and then they're going and getting an allergy test done. So once you have anti-allergic medication in your bloodstream, it is definitely going to impact the result of the allergic testing. So one has to be very clearly understanding the fact that if I'm going to go ahead for any allergic testing, be it a blood test or a skin prick test that I have to do, then I have to make sure that I get off all anti allergic medicine for at least about 5 to 6 days. Okay, a week is a better option, but minimum at least 5 to 6 days before I go ahead and get myself tested for allergy. And once you get tested for allergy, or even sometimes, many a time, some patients don't go ahead with allergic testing specifically. But if we make a clinical diagnosis and understand that it's an allergic rhinitis, then the guidelines are the same across the world. Let me repeat this: allergic rhinitis is very easily treatable, and it is the same standard treatment across the globe. There is no ambiguity in the treatment of allergic rhinitis. There is this misconcept and the myth that people have where they loosely talk about वो allergy है वो तो कभी जाएगी नहीं, we have to learn to live with it and all that. No, that is not true. Allergic rhinitis has a very protocol based, very evidence based, stepwise treatment to it, which has to be followed very meticulously for at least the first couple of months, and then it is need based. So we kind of start the allergy treatment. If the patient responds very well, we step down the treatment and we keep it at that. Many a times, if along with that sometimes there is an aggravation of allergy, let's say you've suddenly gone into a snow region when you're well controlled, or you've suddenly gone into a very hot area and then come back again into a cold area, your body is expected to definitely react to those changes in temperatures, and that is the time when you may need some additional uh, treatment at that time for the control of that exacerbation of allergy. So what I think most viewers need to understand about allergy is, it's very wrong to say. So let me put the question in a different pattern, in a different manner.
Sure.
Do you talk about curing diabetes? Do you talk about curing hypertension? Do you talk about curing asthma? Right? What is the treatment that is done? An asthmatic patient is brought very well under control so that he or she can lead a very normal life. Right? The same applies to diabetes. A diabetic patient leads an absolutely normal life on medication. Right? Only if in case there is a spurt in some sugar level, let's say he goes to a function and lands up having a lot of sweet dishes, then in that case the sugar levels will spike and then he'll need some additional medicine to get it under control.
Right.
Similarly, allergy is, if you are allergic to a particular thing, you may most likely be allergic to it, but you do not need medications lifelong. You need to bring it under control, and then you stop medicines. And then if there's an exacerbation, then you need certain medicines at that time again to get that under control. So the difference between the chronic illnesses of diabetes, hypertension versus allergy is the fact that in allergy you don't need lifelong medications. You need it for a particular period of time. You control your allergy, then you get off it. If there is an exacerbation, you need it again. But having said that, now with the advent of science so much, we are also having the fortunate, science of immunotherapy, whereby if you are allergic to a particular allergen, there are ways to get your body desensitized to that allergen also. And as a result, it becomes very easy for you to then be having that stuff or being, exposed to that without getting a problem. But that's a very, it's a big science, it's a lengthy process. But yes, along with pharmacotherapy, we also have that.
Right. I think that this is again a very important set of information for our viewers, that it's absolutely treatable. It can be managed so well. The only important thing is that in case it's persistent, please don't, start self medicating, especially with over the counter medication. Go and consult the ENT specialist, go and consult your doctor. They'll help you get it treated. They'll help you also in knowing what are the allergens, that are bothering you. There's a very important question from one of our viewer, and I'll definitely like to take that. The question is: are stress and allergies linked?
Um, yeah, definitely they are linked, Sanyukta, because stress causes a lot of hormonal changes. Hormonal changes also cause a lot of imbalance in the way the nose gets engorged, and the tissues around the nose react and behave. Right? So nasal allergies and stress definitely, they are related. So look at it this way: you're sitting right now, you're absolutely fine, and suddenly you hear some news of a death of some close person, and then you start crying. And what happens to your nose? Everybody knows that. Like suddenly
Right.
within 2 minutes, your nose is clogged and you're filled with everything. So that's hormonal, right? That's stress induced. So there is a definite link to allergies, nasal allergies, and stress.
Okay.
And I
There's
must re-emphasize and again put that disclaimer that I am today, when I'm talking strictly with regard to nasal allergies. I'm not
right.
authorized, or either I'm not a specialist in non-nasal allergies per se, because I'm an ENT surgeon. So I'm not going to be able to discuss too much with regards to say skin allergies or things like that. But airway related allergies, yes, definitely.
Hmm. There are these two questions that I'll take. One may not be directly linked with allergies or nasal blockage, but many a times, I mean, again, it happens due to nasal blockage. I don't know in what sense our viewer is asking it. What are the common causes of nose bleeding? I'm sure it has got nothing to do with allergy.
So nose bleeding, Sayukta, is going to happen anytime when the blood vessels in the nose rupture, right?
Hmm.
It's as simple as that. Now, this could be because of trauma. By trauma, I mean some kind of an injury. It could be a simple injury with you fiddling in your nose, and people have this
Hmm.
very dirty habit of nose picking. It
Right.
could be because of some crusts that are formed in the nose, that can happen just because of simple, sometimes dehydration, or for any reason there are a lot of crustings in the nose. And if you pull on a crust, then obviously the nose could bleed. This could also happen most commonly in hypertensive patients. So what happens is the blood vessels in the nose are fragile. They are thin-walled blood vessels. They're not covered with any muscle covering to keep them very intact. And supposing the BP shoots up very high for some reason or the other, so this vessel can burst, and that vessel bursts, and then there could be bleeding. A lot of elderly people generally are on some kind of blood thinners always. This adds and worsens to the fact that, okay, there is one small bleed, but it doesn't stop bleeding with the natural coagulation that we have in our body, and as a result it continues to bleed more. So anything and everything that may damage a nasal blood vessel. This could be in the form of some diseases also. We have granulomatous diseases in the nose. We have sometimes malignancies in the nose. We have some, many kind of diseases which have a little growth here and there. And the blood vessel on that can rupture. So these are
Right.
most common causes of nose bleeding.
There's this one question, which is going to be my last question from a viewer's side. I'm not sure again whether it's directly linked with our topic today, but still I'll take it. If Doctor, I'm severely asthmatic, what special precautions should I take when fighting a cold or flu?
So, severely asthmatic patient also will have to take the same precautions as most others, like I said, with the red flags that I mentioned. See, your airway is more prone to constriction, as we call it, or collapse, because you are an asthmatic. Now, the airway, the concept now in the world is one airway, one disease. So, once upon a time, we used to think that the upper airway constituted only the nose to the throat, and then the lungs downwards, or rather the trachea downwards, constituted a different airway. Now it's been more than about 2 decades where the concept has become a one airway, one disease. So allergic rhinitis and asthma are actually sister concerns, if I may say so. They are part of the same disease process. The nose part is called the rhinitis part, and the part in the lungs and the chest and everything is called the asthma part. But the airway is the same.
See.
So, invariably, if you have a problem in the upper airway which is not getting solved, it is going to aggravate your lower airway problems, and vice versa. If you
Right.
have an uncontrolled asthma, then your allergic rhinitis will also not come under control very easily. And that is the time when we have to have a conjunction and a treatment protocol between both the ENTs and the pulmonologists together. So your question with regards to precautions is basically just try to keep yourself with the steam inhalation. Make sure you take very, very good treatment for your initial cold. You are not the kind of person who should be waiting for 3, 4 days with home remedies and things like that, because you know that it could aggravate worse in you. So in your particular situation, it would be I mean, it would be very prudent to go ahead and meet your ENT specialist or your chest physician right at the beginning on the first or second day itself, because you know that waiting too long could aggravate the other problem of yours. It could worsen your asthma and not just the upper respiratory tract. And of course you must take all precautions of using masks and trying to avoid all the allergens as you can. See, understand one simple concept. This is for the viewers. I would say that
Right.
identifying the allergen and keeping it away from your body is much more logical than having to take medication for it, right? It's a very simple thought process. So, if you know that you have allergies, or if you know that you are allergic to a particular thing, just try to avoid it. That is better. It will help reduce the dose of medication also that is required for you.
Right. Doctor, before we wind up the whole session, anything that you think we have missed out on, or any take home message, or anything that you would like to tell to our viewers?
So I think Sayanta, this is a very, very good initiative on your part. I congratulate you and the entire team that is going ahead with these kind of programs. Because see
Thank you.
what we have to realize, and I would like all the viewers to keep this very, very um, well imprinted in their minds. Once upon a time, allergy used to be taken very lightly. Oh, it's allergy, okay, we still have to work, we still have to go on, and things like that. But allergy and sleep are such silent killers. You will not believe the impact that they have on your quality of life. And if you look at the world globally, okay, the incidence of allergies are constantly increasing. The incidence of sleep disorders are at a very high level, very high level. The latest and the best statistics that we have out of India, out of our own country, evidence based, latest studies are pegging the incidence at 34%. 34%. This is way, way higher than HIV, diabetes, or any of these other chronic illnesses, or in fact heart diseases to that effect. And heart diseases also are a cause of, or rather, could be a complication of your sleep disorders. So, what has happened across the globe is that most of the countries and everybody has woken up to the impact of the quality of life deterioration because of these two disorders. And why this has happened is because there's a lot of productivity. So, if you have nasal allergies, if you're not feeling too great, your work suffers, absenteeism increases, work performance goes down. If you have not slept well for a couple of days, or if you're sleep deprived, your productivity goes down. There are chances of a lot of dangers of accidents and things happening. Now, these are things which a layman may not have understood it, but governments across the world have understood this. They have understood the impact of the low productivity and the impact of the deteriorating quality of life and the impact of these two disorders causing many other complications if not treated on time. And because this has happened, there have been regulatory bodies, there have been guidelines, there have been things with a very systematic approach towards increasing awareness in these two disorders, as well as increasing the treatment or getting the treatment protocols in place. Because ours is a much larger country, it's taken a bit more time as compared to the other countries that have lesser population, and maybe the working differs everywhere. But believe you me, it is time to wake up to the ill effects and the importance of not treating allergic rhinitis and sleep disorders in today's data. This is a very, very important take home message that I would ever propagate to anybody asking me the last question that you kind of asked me, that what is important about this. It is not to be taken lightly, and one
Right.
need not go into the complications because that tends to scare people. We are not here to scare anybody. The fact to understand it is these are very, very easily diagnosable problems and very easily treatable problems. And most of the, I mean, there is not that much of surgical intervention involved in treatment of allergies. So when you know that something is so easy to treat once you diagnose it, you should not shy away from this, or even for that matter, sleep related disorders.
Right. Thank you so very much, Dr. Seemab Shaikh, for sharing such valuable insights with us today. This session has definitely helped our viewers, understand how allergies can silently affect our sleep and breathing, and why timely treatment is so important. We truly appreciate your time and expert guidance, and really look forward to having you with us again in future sessions. Thank you so very much once
Thank you
again.
so much, Sayunta. Thank you very much. My pleasure too. And I look forward to interacting with you at some other time. Take care.
Sure.
Thank you.
Thank you, Doctor. And thank
Bye.
you, viewers, for joining us today. Stay connected with the Resonance Show, and don't forget to like, share, and subscribe to our channel. This program is brought to you by the makers of Bilacet M, Vertigen, and Opox CB200. Thank you. Have a great day ahead. Goodbye.
Thank you. Bye bye.